I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video edition on speeding up recovery after DMEK surgery. So what can you do to speed up the return of vision? Well, it's basically about doing things that don't compromise the return of vision. First, let's remind ourselves what DMEK surgery is. It's cell transplantation where I replace a layer of cells on the back of the cornea. That layer of cells is so thin it's less than half the thickness of your hair. And to really picture what it's like, imagine a ping pong ball. Here's a model eye, but imagine it's a ping pong ball, and you take a 9mm disc of Glad wrap. So you punch a 9mm disc, make a small cut in the eye, and without touching that disc of Glad wrap, you have to pick it up, put it in the ping pong ball, and float it up to stick on the undersurface of the ping pong ball without touching it. Well, it's not smoke and mirrors. It's actually done with a combination of fluids and gas to manipulate it into position. But if you see the ping pong ball like that, a bubble of air has to hold the cells up against the cornea, and it's once the cells start functioning that it can actually suck on and attach. So we've got that transition period. It's a transplant. So here are the things that people do that compromise this. Firstly, there's a bubble of air inside the eye holding it up against the cornea. The longer it keeps it in that position, the more likely it'll stick. Stand up and the bubble rises, and the cell transplant can come away. So the first thing you can do is, as much as you can, lie flat for at least the first 24 hours, and if you can, 36. Yes, there's back pain, neck pain, and above all, the greatest pain, boredom. But if you can do it, it helps. That's number one. The second thing is this. Every time you blink, your eyeball goes back in the socket by at least 1 millimeter. But if you blink strongly because the eye is irritating, or you're just a natural blinker and you're doing that, every time you do that, you are compressing the front of the eye and you're pushing the cell transplant off the back of the cornea. The patient that squeezes the most, I have trouble getting their transplant to stick. Finally, the third thing, which is really an extension of two, none of this rubbing. You shouldn't be rubbing anyway, but even simple things like this, you will squeeze the front of the eye and push the cell transplant off. It won't stick. If you follow those 3 simple rules, you'll maximize your chance that those cells will stick and stick quickly. I hope that all makes sense. I'm Dr. Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.